Hello, myself Mohammad Sarfaraz Khan from the block 7. Now I am going to do the ear examination. For ear examination, I will start with the inspection first. I look for any skin lesions or any skin tags, scars. I found no skin tags, anything, it's normal. Now I am going to do the ear examination. For doing the ear examination, I will use the otoscope and the largest speculum. You hold the otoscope like this, and for the inserting the otoscope, I will hold the pinna in upward and the backward direction, and I will insert the speculum inside downward and the forward direction. I can see the eardrum, cone of light, pars tensa, pars flaccida, handle of malleus. So I'll repeat the same thing on the left ear by handing the otoscope in the left hand. So I can see the eardrum, cone of light, pars flaccida, pars tensa, handle of malleus, and I can see no abnormalities or no discharge. Thank you.
I'm Mohammad Zaid Khan. I'm a medical student. What's your name?
My name is Piyada Sakilom.
What's your age?
23 years.
I will be examining your ear by using tuning fork. Is that okay with you?
Okay.
First, I will be doing the Weber test. For this, I will place the tuning fork on top of your head in the midline. Tell me if you hear the sound equally on both ear or not.
Okay.
Equally. So there is no lateralization, which is normal. Next, I will be performing Rennie test. For this, I will place the base of the tuning fork on top of the master joint behind the ear, and again on side of the ear. Tell me when the sound stop. Okay.
Stop. Stop.
Repeating the same process on the other ear.
Stop. Stop.
So ear conduction is better than the bone conduction, which is normal. Your ear examination is normal. Thank you for your cooperation.
Thank you, doctor.
Hello, this is Mohan Raj Uma Maheshwari. I'll be performing your nose examination today. Is that okay with you?
Yes,
May I please know your name and age?
I'm Swastik, I'm 21 years old.
Before starting the examination, we'll make sure that the lighting of the room is proper. We'll begin with inspection first. We'll inspect your nose, look at the contour of your nose, check for any external nasal deformity like saddle, hump or crooked nose. There is none. We'll look at the array of your nose, which is normal, and there are no signs of any pinched nose, which is an indicator of allergic rhinitis. Moving on to palpation. Before beginning with the palpation, I'll glove myself up. Do you have any tenderness or pain in your nose?
No.
Okay. Now, with one hand, I'll stabilize the patient's head, and with the other hand, I'll palpate the nose gently. I'll look for any tenderness, pain, swelling or mass. There is none. Now we'll be examining the anterior part of your nose. For this, I'll be lifting the anterior tip of your nose gently. Use my pen light and look at the vestibule and the vibrissae of the nose. We'll be checking for any signs of vestibulitis. Look for any nasal septum deviation, any septal hemangioma or polyps. There are none. Now we'll be performing the nasal patency test. For this, I'll be using a clean steel spoon instead of a tongue depressor. I'll first block one side of your nose and place the spoon below the other and ask the patient to breathe. Please breathe. We'll be doing this on the other side as well. There's supposed to be mist formation. In that case, there is no nasal obstruction. There is mist formation here on the spoon. Now we'll be performing the Cottel's test to check for chronic sinusitis. For this, I'll be lateralizing your cheeks. And we'll be doing this on the other side. So are you able to breathe better after the lateralization of the cheek?
Yes.
Okay. So if Cottel's test is positive, if the patient says that he is able to breathe better after the lateralization of the cheeks, it's negative if the patient says that there is no difference. Now we'll be performing the anterior rhinoscopy. For this, we are supposed to use a nasal speculum, but I'll be using an otoscope instead. Okay. So I'll be inserting the otoscope into your nostril by stabilizing your head. Okay, repeating it on the other side. Gently lift your head. Okay, so we'll be looking for signs of deviated nasal septum, any nasal polyp or turbinate hypertrophy. Look for any signs of inflammation like foreign body or
Hi, I'm Muralidharan Rohitcharan. I'm going to perform an oral examination. Is this okay for you?
Yes.
First, you want to inspect the lips for colorations, moisture, central sinuses, and pallor. And check for again any there is ulcerations, scalings, or crackings in the lips. Now we are going to inspect the oral cavity of the patient. Ask the patient to open her mouth. Using the pen light, I'm checking her oral cavity. Check for if there is any discolorations, ulcers, nodules, or papules present. Now we are going to inspect the teeth of the patient. Ask the patient to show E. So check for any there is any discoloration in the teeth, there is any losing of teeth, there is symmetry of the teeth, and check for any ulcers, nodules, or discoloration is present in the gums margin and internodontal papillae. Now check for the palpate the teeth of the patient. Ask the patient to so using the thumb and index finger. So just gently press the teeth and move. In this, you can check whether the patient has any facial pain or jaw pain when we move the teeth, and also check for any missing teeth and dissymmetry of the teeth. Now we are going to inspect the roof of the mouth. Ask the patient to open your mouth and check for any discoloration and symmetry of the hard palate. Next, we are going to inspect the tongue. Ask the patient to prepare her tongue outside and check for any discolorization, ulcers, white patches on the dorsal region and the roof of the bottom of the mouth. You can check for any polyps and ulceration is present. And the same way you have to check for the hypoglossal nerve deformity. Ask the patient to move the tongue left and right. Okay. Now we are going to palpate the tongue, and using the gauge we can have the catch the tip of the tongue, the patient, and we can just palpate on the sides to find there is any indurations. Now we are going to inspect the pharynx. Ask the patient to open her mouth, protrude the tongue, and say so that we can find visibly see the posterior pharynx. Now we inspect the soft palate, posterior and anterior pharynx, whether the ulva is in midline, and also inspect for the tonsils. There may be any tonsillitis is present. We can visibly seen in this inspection. Yeah, that's it. We are done with our oral examination. Thank you.
Myself, Muralidharan Rohitcharan. Now I am in internship. Now I am going to inspect your lymph nodes. Is that okay for you?
Yes.
Preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, to deep cervical, post cervical, and supraclavicle. Lymph nodes are normal. There is no swelling. Thank you. Now I am going to inspect your neck. Look up. Now I inspect the trachea. Okay. Now I am palpate the trachea. Okay. Trachea is in pain. Now I am going to auscultate the trachea. Can you breathe with your mouth? Okay. There is no stethoscope. Now I inspect the thyroid gland. Can you look up? Now I can see the thyroid gland ridges. Okay. Now you can swallow. Yeah, I can see the isthmus move up and down. Now I am going to palpate the isthmus. Can you swallow again? Okay. Now I am going to palpate the thyroid gland. Okay. There is no swelling. Thank you.